Hi, I'm Hannah, and today I will be talking about current trends in gaming addiction. What is gaming disorder? The definition can be found in the International Classification of Diseases, which is a standardized system created by the World Health Organization for classifying diseases, injuries, and causes of death globally. The definition states that gaming disorder is a pattern of gaming behavior characterized by impaired control over gaming, increasing priority given to gaming over other activities, where gaming takes precedence over other interests in daily activities, which can lead to occurrence of negative consequences. There are several contributors to gaming addiction. To start out, players receive positive reinforcement and instant feedback from gaming. So every time players win and receive a reward or complete a level to move on to the next one, this is positively reinforcing them to keep playing and winning to receive more rewards. They also can get instant feedback each time from a win, looking at things that they did wrong in ways that they could improve. Games can also give players a social identity and the ability to connect with others. Players can be whoever they want while gaming, so they can develop a social identity through their games and talking to others who sometimes they do not even know. Some players feel that they can be themselves more while gaming, and that is an outlet for them to get away from the real world. Players can experience increased dopamine levels, and research that has shown that while gaming, dopamine levels increase due to the brain's reward system constantly being stimulated. Dopamine levels increase even more with unpredictable rewards, like finding good loot or having a surprise win. This can give players more motivation to play again and again. It becomes an issue, however, when gaming is the primary source of reward and other activities are not enjoyable anymore. Players also feel the game allows them to escape life to a better version of it. Like I said before, this can help players get away from stress or bad things happening in their life. Adolescents who already have depressive symptoms and social issues are more likely to be diagnosed with gaming disorder. This is called a risk factor. If players are already struggling with depression or their social life, this makes them more vulnerable to developing gaming disorder as well. They commonly get stuck in a downward spiral, using gaming as an unhealthy coping mechanism to get away from the bad things in their life, like depression or having social issues, for example. Now I will talk to you about gaming addiction statistics. Before we start, I'd like to explain prevalence rate because it is included in a lot of these statistics. So prevalence rate is the total number of people who have a disorder or characteristic, and it is expressed as a percentage or proportion. First, there are 60 million individuals affected worldwide, and the global prevalence rate is 3.05% compared to the young adult prevalence rate at 10.4%. So you can see that it affects young adults more than everyone else. The highest prevalence rate is in the Middle East and Southeast Asia for 10.9% for the Middle East and 10.1% for Southeast Asia. North America has a prevalence rate between 1.7% and 10%, and this is because it is such a wide range, including both the United States and Canada. Males versus females is 8.5% to 3.5%, so you can see here that it affects males more than it does females. The average gaming time per week is 8.45 hours, and this is for the average person. And if someone is gaming for more than 20 hours a week, this indicates that they could possibly have the disorder. And only 8% of those that meet criteria for gaming addiction actually seek professional help. And this is a low percentage, so hopefully in the future, more people will want to seek help. There are several treatment options for gaming disorder. First, taking a break from gaming is a good option. If gaming turned into the primary source of dopamine, like I explained before, then taking a break from gaming can allow these dopamine levels to reset. This will allow for other activities to start to become enjoyable again. Next, cognitive behavioral therapy is one of the most researched and effective forms of therapy and revolves around a patient's thoughts, feelings, and behaviors. This works on changing negative or distorted thinking patterns to improve mental health. Group therapy is when patients all meet in a group to talk about struggles, learn skills, and support one another. Counseling is meeting one-on-one with a counselor so the patient can share how they are struggling and the counselor can recommend several strategies to help them. Here are my reference slides. Thank you for listening to my presentation. If there are any questions or comments, you can leave them in the discussion board. Thank you.